Hello, this is a new CJSON podcast and I am Ángel Sevillano, nephrologist from Madrid. I am here with my colleague Dr. Manuel Praga.
Hello.
It is our pleasure to discuss with you on behalf of the Spanish group for the study of glomerular diseases, GLOSEN, our recent publication in the journal titled IgA Nephropathy in elderly patients.
IgA nephropathy is the most prevalent glomerulopathy around the world and mainly affects young patients. However, some studies suggest that the incidence of IgA nephropathy could be increasing in older adults, but data for older adults in this disease are limited. So we designed a multicenter study to collect data about patients older than 65 with biopsy-proven IgA nephropathy and compare the data with a control group of biopsy-proven IgA nephropathy patients younger than 65 studied at the Hospital 12 de Octubre in the same period.
151 patients with an age of 65 years or older were collected in 23 centers between 1990 and 2015. The median age of our population was 72 years and the follow-up was of 24 months. The most common form of presentation was asymptomatic urinary abnormalities in 55%, followed by acute kidney injury in 40%. The most common type of acute kidney injury was hematurelative acute kidney injury, 86%, while the remaining cases correspond to presenting IgA nephropathy. A clear increase in the diagnosis of IgA nephropathy among patients older than 65 years was observed over time, from 6 cases in the period between 1990 and 1995 to 62 cases in the period between 2011 to 2015. Among hematurelative acute kidney injury, 18 patients, 54%, were receiving oral anticoagulants. For the whole cohort, kidney survival without death or the need for kidney replacement therapy was 74% at 1 year, 48% at 2 years, and 26% at 5 years. Serum creatinine at presentation and the degree of interstitial fibrosis in kidney biopsy were risk factors significantly associated with the outcome, whereas treatment with renin-angiotensin-aldosterone blockers was associated with a lower risk. Immunosuppressive treatment were not significantly associated with the outcome. Compared with the propensity-matched cohort of IgA nephropathy younger than 65 years, the composite endpoint was significantly worse among the elderly population.
Our study shows an increasing number of IgA nephropathy in patients older than 65 years diagnosed over the last 25 years. Another important finding in our study is the increasing incidence of acute kidney injury as the first manifestation of IgA nephropathy, in the great majority of cases coinciding with an episode of macroscopic hematuria. Our data suggests that the high prevalence of anticoagulant treatments in the older population can contribute, at least partially, to this epidemiological change.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.